By the end of this year, 9,000 men here in Ohio will be diagnosed with prostate cancer. It is the second most prevalent form of cancer, but by no means should it be considered common, nor should its treatments. So in this segment, sponsored by Columbus CyberKnife, we're looking at the unique way they have of treating this disease. And it's always good to have with me Dr. Douglas Widman. He's the medical director and board-certified radiation oncologist at Columbus CyberKnife. Dr. Widman, thanks for being back.
Thank you for having us, Robin.
You know, September is National Prostate Awareness Month. What would you say the purpose of this month is, and why is it so needed?
Well, every September it gives us a chance to just get out in front of the public and maybe have them think a little bit about prostate health where otherwise they wouldn't.
And what are some of the risk factors if somebody's out there, that they think, hey, my odds might be a little different than somebody else's? What would you want to tell them?
We do know a couple of things about prostate cancer risk. Age is an obvious one that I think most people are aware of. You're more likely to get prostate cancer if you're older. Sometimes there might be an inherited risk. And then we also know that African American males are at higher risk for having prostate cancer.
All right, Dr. Widman, a lot of times people don't know that there are various treatments, CyberKnife being one of them. So let us know, this is a robotic radiosurgery system. Let us know exactly how it works.
First of all, it's external beam radiation therapy. And what is unique to the CyberKnife system is that we are able to image the prostate gland the entire time that radiation therapy is given, so that it virtually guarantees us that we're not going to have any radiation stray off of the target. And it is a robot. It's an industrial robot. So it gives us the ability to deliver the radiation beams from multiple different angles and do that efficiently, do it in a short period of time. That just doesn't happen with any other technology that's available out there right now.
Yeah, you always, want to have the least amount of side effects and everything that follows after you have this treatment, which you've talked about CyberKnife. That's one of the biggest benefits too.
That's right. That's right. Minimal side effects. If patients have side effects at all, it's usually a couple of weeks of urinary changes. But compared to all other forms of radiation, the side effect profile is really attractive, minimal side effects. Really, the most clear advantage is that because of the way we're doing the radiation, we can compress it into just 5 treatments. In most cases, wherever a patient goes to have radiation for prostate cancer, it's usually going to be a minimum of 6 weeks, sometimes as many as 9 weeks. So when you talk to patients about just doing 5 treatments, it's just the obvious convenience of that compared to weeks-long treatment.
And Dr. Widman, I did want to mention it's smart to know the signs of prostate cancer too. Are there any that people should look out for that men should be aware of?
The majority of patients that we're taking care of are found to have prostate cancer because they happen to have a PSA blood test as part of a screening test, or let's just say they're in for an annual physical examination, and as part of all their blood work, they happen to have a PSA check. And it comes back abnormally elevated, and it triggers a prostate biopsy. So most patients have no symptoms. However, if prostate cancer for some reason is undiagnosed and it has an opportunity to grow and grow and grow and becomes advanced stage prostate cancer, that's when patients can have symptoms. It can affect urination. It can trigger blood in the urine. In its most advanced stage, it can get out into the skeleton, and unfortunately can cause pain, significant pain.
Yeah, it's something that you need to just be aware of as far as having your screenings done at the appropriate time. Be checking in with your doctor and have those regular exams, and talk to your doctor, of course, if there is anything concerning. And you can learn more columbusck.com about CyberKnife, or call the number on the screen, of course. So Dr. Widman, thank you so much for being here.
Thank you again, Robin. We appreciate it.